Today we're not going to talk about a specific condition, but actually the medications that we often use to treat arthritis and other rheumatology diseases, and particularly how we could potentially use them during pregnancy. So it is common that individuals who are those of childbearing age may have a rheumatic condition. We see that commonly in our rheumatology clinics. Examples include rheumatoid arthritis, psoriatic arthritis, lupus, ankylosing spondylitis, myositis, vasculitis, and more. In the vast majority of these cases, a safe, successful pregnancy is a realistic goal. And perhaps more than anything else to take out of this, please ensure that you speak with your rheumatologist well beforehand when thinking about becoming pregnant. Well beforehand being at least 6 months, ideally, if not a little bit longer. One of the principles your rheumatologist will use is to say that the better disease control that you have before getting pregnant, the better chance of your disease being in good control when you're pregnant, and therefore having a better outcome, safe pregnancy, and good control of your disease without causing other problems during pregnancy. But let's talk about medication specifically, because a lot of people are not comfortable being on medications when pregnant, and for good reason, as there are many that are unsafe for the fetus, the unborn child, when you're pregnant. So we'll run through some of those. So as an example, NSAIDs, anti-inflammatories, very common over-the-counter, things like ibuprofen, otherwise known as Advil or Motrin, naproxen, which is known as Aleve, but there are many others which you can get as prescription from your physician as well. Typically, we would say these are not safe at all during the third trimester of pregnancy. So the last 3 months, they should be avoided as it actually can impact how blood flow occurs in the fetus, which can cause significant problems for them when they're born. There's also some concern earlier on, and even in fact around conception. This isn't an absolute contraindication, but certainly if you're having troubles becoming pregnant and you need an NSAID on a regular basis, is something that to consider and speak with your rheumatology team about some alternatives here. Medications that you absolutely should not be on when you're pregnant, and in fact are important to be off well in advance of pregnancy, are some of our more common disease-modifying agents, including methotrexate, leflunomide, otherwise known as Areva, and while we don't use it as often as more, for our more serious conditions, medications called cyclophosphamide. Well, one would argue that if you're on cyclophosphamide, you probably should not be thinking about getting pregnant because it means whatever condition that you have, it's quite serious, you're quite sick, and becoming pregnant may not be safe anyways. But certainly with methotrexate and leflunomide, those individuals may have very good control of, say, their rheumatoid arthritis, but they should not become pregnant. It's possible to, but it would not be safe to be pregnant on these medications. In fact, we would recommend for methotrexate to be off methotrexate for at least 3 months before trying to become pregnant. And for leflunomide, you actually might need to be off it for at least a year. Now, sometimes that's more challenging. Your rheumatologist does have access to medications which can actually remove leflunomide from your body to kind of hasten that time period. And that's a discussion that they can have. Some rheumatologists may not use leflunomide in younger women for concern around those sorts of issues. But certainly young women can use these medications. Just some thought has to be made as getting closer to a time that you might be considering pregnancy. There are a number of medications, fortunately, which are generally considered safe during pregnancy. Now, in a lot of individuals, they don't want to be on any medication, and that might be appropriate. It also may depend on the condition and so forth. So, for instance, rheumatoid arthritis may actually go into remission on its own during pregnancy, therefore may not need medications, whereas some of our other diseases, pretty much all the other ones, that's not the case, and you may need something just to help keep control. Hydroxychloroquine is one of our gentlest, safest medications overall. Unfortunately, it is safe in pregnancy as well. One of the concerns overall with hydroxychloroquine is its effect on our eyes, and it could potentially cause some damage there. It's very rare, and in fact, from a pregnancy point of view, there have been no reported cases that it's caused any problems with the fetus's eyes or child once they're born. Other medications which are generally considered safe: azathioprine, prednisone, which we like to avoid overall, but low-dose prednisone may be appropriate during pregnancy, particularly if there's a small flare that we need to get over it. It may be very appropriate to use some low-dose prednisone rather than allow the disease to continue to flare. Cortisone injections are a great option for someone who might have one or two joints which are bothering them, but otherwise doing well, because that's medication which is given directly into the joint and not given systemically. Biologics probably are safe. The group that we have the most data on are TNF antagonists. Those are our biologics that we've been using for rheumatoid arthritis for the longest period of time, 20 plus years of experience. Certolizumab, brand name Cimzia, is considered probably the safest of our TNF antagonists in that it least crosses the placenta, but very likely all TNF antagonists are safe, and many women will continue on their biologic, on their TNF antagonist through pregnancy without problems to them or to their child. From a pain control point of view, acetaminophen, Tylenol, considered safe as well. Now you'll see we have not mentioned many other medications which we use in rheumatology, and that's because there's less clarity. So to be able to say as definitively about their safety is more challenging, and that's where talking with your rheumatologist, your rheumatology team, is really, really important. And really, in fact, that is important regardless. We would strongly encourage you to speak with your rheumatology team if you're on the medications which we listed as safe, or those not, to ensure that you have a safe and successful pregnancy with your rheumatic condition as well. We have information on any of the diseases we spoke about, as well as many of the medications on other YouTube videos. But as always, we would also ask you and share with you to join us on our website at operatorrheumatology.com.